Hello, my name is Brianna Burpo. I'm a student here at the University of South Alabama, and today I'm going to be performing a medication administration video for my NU311 class. Here's my identification. I'm in compliance with the uniform. Here is my area. And I'm going to go ahead and get started. So first thing first, I'm in a quiet area with no interruptions or disruptions. I won't take any phone calls or anything, and I will limit the conversation to only the important things. So first thing first, I have my medication administration record, and I have my patient order form. So what I want to do first is I want to compare the two. So we have Jaguar Jones, medical record number 4176352, medical record number 4176352, allergies penicillin. The drug is morphine sulfate. It is 5 milligrams IM. 5 milligrams IM is every 4 hours. PRN pain. So both of the documents matched up equally and correctly, which lets me know that I have the correct elements for a legal prescription. So I'm gonna go ahead and I'm gonna sit this over here and I'm gonna begin to prepare my drug. So first thing first, I want to perform hand hygiene, of course. So we're still on Jaguar Jones, of course, and the medication is for morphine sulfate. So I have morphine sulfate right here. As you can see, morphine sulfate. The expiration date is December 20th, 2025, which lets me know the drug is good. The order is for 5 milligrams. This is 10 milligrams a milliliter, which lets me know that I will distribute half a milliliter. It is for IM, so I will use this 3 milliliter syringe, this blunt plastic cannula, and this 23 by 1 gauge. So first thing what I want to do is I want to go ahead and get started. So I'm going to perform my hand hygiene again. I am going to clean the top of the valve, of course, before you do anything. And I want to take my syringe. I'm going to open it, pull it out. Then I'm going to do the same thing with this, making sure I'm not touching the tip. Don't want to touch the tip. So put that in there. So the order is for morphine sulfate. Morphine sulfate is for 5 milligrams. So this is 10 milligrams, which lets me know I'm going to do half a milliliter, but it's for IM. So with that being said, I'm going to put half a milliliter of air in it. And now what I'm going to do is I'm going to take that, put it in here, and I'm going to inject the air in it. And now I'm going to pull it back and forth to make sure I don't have any air bubbles in it. We don't want any air bubbles. And I'm going to load up a half a milliliter. So that's a half a milliliter. Now I'm going to scoop this up right here. Scoop this up. So as you can see, I have a half a milliliter in here. It is a half a milliliter. So now what I want to do is I want to take this off. I'm going to put that in the sharps container, and I'm going to place my needle on it. Again, not touching the tip. Then I'm going to place that in there. So now what I want to do is I want to perform my first check. So we have Jaguar Jones. We have medical record number 4176352. Medical record number 4176352. It is for morphine sulfate. This is morphine sulfate. The expiration is good. It is for 5 milligrams. This is 10 milligrams. So I drew up half a milliliter. It is for IM. This is the correct syringe and the correct needle for an IM injection. It is for every 4 hours. Mr. Jones hasn't had it in 4 hours and is PRN for pain, and he's telling me that he is in fact in pain. So that is my first check. So now what I'm going to do is I'm going to prepare a label. And while doing so, I'm going to use my paper to correctly check. So we have Jaguar Jones. Jaguar Jones. So I'm going to write Jaguar Jones. It is for, let's see, medical record number 4176352, 4176352. It is for morphine sulfate. I have morphine sulfate, so I'm going to write morphine sulfate, morphine. And it is for 5 milligrams. And this is 10 milligrams a milliliter, so I'm going to write 10 milligrams / half a milliliter, because that's how much we're administering. And it is IM. Of course, we have the correct syringe and needle for IM injection, and it is in fact a half a milliliter, and it is for every 4 hours. He's had it 4 hours ago, and it is PRN pain, and he is telling me he is in pain once again. So now what I'm going to do is I'm going to place this label onto my needle. And then I'm going to perform another check, just to be cautious, just to make sure. So we have Jaguar Jones, Jaguar Jones. We have morphine sulfate. Morphine sulfate is 5 milligrams. And this is 10 milligrams. So we did half a milliliter, of course. It's every 4 hours. He had it 4 hours ago, and it's PRN pain, and it's for IM. So this is the correct syringe, and this is the correct needle for IM injection. So now what I'm going to do is I'm going to take my needle, my drug, and my paper, and I'm going to go ahead in the room and prepare to give Mr. Jones his medicine. So we've made it here to the place that we need to be. So everything's set up. All right. So first thing first. Hello, my name is Brianna. I will be your nurse for today, Mr. Jones. So perform my hand hygiene. So first thing first, I want to check your wristband. So the name is Jaguar Jones. Jaguar Jones. Medical record number 4176352, 4176352. Allergies to penicillin, allergies to penicillin. Now, Mr. Jones, is there any other allergies that you would like to let me know about? Well, no, that's all. All right, then. Well, next thing I want to do is I want to do a pre-assessment on you, okay? So I can see that you're in a lot of pain right now. So we're going to go ahead and we're going to administer your morphine sulfate. So I want to do one more check just to make sure. So we have Jaguar Jones, Jaguar Jones, Jaguar Jones, medical record number 4176352, 4176352. Allergies to penicillin, allergies to penicillin. Mr. Jones, you told me you don't have any other allergies. The order is for morphine sulfate. Morphine sulfate, morphine sulfate is for 5 milligrams. This is 10 milligrams, so we did half a milliliter, which is 5 milligrams is a half a milliliter. So in this IM, this is the correct syringe and a correct needle for an IM injection. It is for every 4 hours. You haven't had it in 4 hours, and it's PRN pain. And I just did a pre-assessment, and you are in fact in pain. So now we're just going to go ahead and proceed to doing the injection. So first thing first, hand hygiene. I want to position the patient to comfort. So we're going to put you on your side, Mr. Jones, and I'm going to insert this in the ventrogluteal on your side. So I want to perform my hand hygiene. And now what I want to do is put on my gloves. All right, Mr. Jones. So I'm going to take an alcohol pad and I'm going to clean the area. And I'm going to clean in a circular. I'm going to clean in a circular motion, not overlapping the same area that I already cleaned, which will be contaminating it. And I'm going to place this alcohol pad right there just to make sure. So being that this is an IM injection, I'm going to do it at 90 degrees, at a 90-degree angle. So put that in the sharp container. So I'm going to pull the skin apart and I'm going to inject it. And now this is an IM, so I am going to aspirate just to see if I can see any blood, which I cannot, which lets me know I'm good to go. So now we'll slowly inject it. All right, now I don't have a safety needle on here, so it's gonna go straight into the hazard thing. And now I'm gonna apply pressure on it just to make sure that it doesn't bleed, because we don't want it to bleed. Now, how are you feeling, Mr. Jones? Okay, so now what I'm going to do is I'm going to throw that in the trash. I am going to take off my gloves. I'm going to perform my hand hygiene. I'm going to position the patient back to comfort. I'm going to let Mr. Jones know that I will be back in 15 minutes to check on him, just to make sure that he didn't have any allergic reaction to the medication and to make sure that he is feeling okay. So now I'm going to position him back to comfort, lay his bed down to its lowest position, perform hand hygiene again, and I am going to go back to the station and I am going to document everything. So, is there anything that you need from me, Mr. Jones, before I leave? Alrighty then, well, I'll be back in here in 15 minutes to check on you, okay? Alright. And this concludes my medication administration NU311 video.